My name is Morgan Gaynor. I'm a genetic counselor here at Ironwood Cancer and Research Centers, and today I'll be speaking on talking to family about your positive genetic test result. Finding out that you tested positive for an inherited risk for cancer can sometimes lead to feelings of anxiety, fear, or sometimes even peace, as it may provide clarity. Amidst the whirlwind of feelings running through your head, you may think to yourself, who needs to know about this result, and what do I say? Because your positive test result indicates a hereditary cancer risk, sharing this test result with your family is one of the most impactful things you can do. However, sometimes that's easier said than done. Depending on your family dynamics, there are inevitable roadblocks that make it a difficult discussion to have. If your family is aware that you're having genetic testing, that conversation may arise naturally, but that's not always the case for everyone. We know that some people struggle with the guilt of passing on genetic mutations to their family. Please know that all of these feelings are completely normal and that you're not alone. In hopes of making this process as easy as possible for you, we've assembled a list of points to go over with your family to make this conversation easy and concise. If you test positive for a gene mutation associated with an increased risk for cancer, your children, parents, and siblings have a 50% chance to have the same mutation that you have. In addition, it's also important to speak to your extended family members on both your mom and your dad's side of the family, because they could be at risk for inheriting this mutation as well. Secondly, both men and women who inherit this mutation, whether they develop cancer themselves or not, can pass this mutation on to both sons and daughters. Members of your family can choose to get genetic testing to find out if they have the same inherited mutated gene. This is called predictive testing because a positive result for them means that they have an increased risk for developing cancer as well. But this doesn't mean that they have cancer or that they're definitely going to get cancer in their lifetime. And fourth, family members can take a copy of your genetic test results to their doctor, and either their doctor can order that same exact testing for them, or their doctor can always refer them to a genetic counselor in their network to assist with that testing. It's also important to remember that only a handful of hereditary cancer syndromes are associated with an increased risk for cancer in children. So unless your mutation is associated with one of those syndromes, those children can wait until they're 18 to have that genetic testing done. And therefore, it's fine to wait to have these conversations about adult onset syndromes with children until you think they're ready to process that information. If the thought of sharing this information with family feels overwhelming, some people find that starting with confiding in a partner or a close friend can be beneficial. Other people find it helpful to ask one family member who's in contact with the whole family to share that information for them. In addition, some people find that sending a letter to all of their family members can be helpful as well. Your local genetics service is also here to help provide support, help you build a communication plan, and be a resource for family members who may be interested in testing after finding out about your result. If you have more questions about genetics, please feel free to speak to your Ironwood provider about a referral to one of our genetic counselors here. For more videos related to topics about cancer or genetics, please visit the Ironwood YouTube page or website.